Welcome to Medically Speaking. Our guest today is Shannon Bryant, the Chief Diversity Inclusion Officer for Kaleida Health. Shannon, thanks for joining us today.
Thank you for having me.
So you're in your role relatively a short time at this point. If you can, tell us a little bit about who you are and how you came to Kaleida Health.
So I'm Shannon Bryant, born and raised here in Buffalo, New York. And I was attracted to Kaleida Health because it's such a great community staple. Knowing the slogan, leading with care without even being an employee here, was a good reason for me to want to join the team. And right now, I have background in clinical mental health counseling and chronic health conditions, as well as a lot of community work. And right now I've been able to use a lot of that work within the role that I'm doing here for the health system.
Got it. So as you come into the organization at the end of 2020, you're tasked with helping devise a diversity inclusion program. Let's start with the benefits of that. Why is that important for an organization such as Kaleida Health to have that type of programming within the organization?
I think that is important for any organization to have. Specifically here at Kaleida Health, it aligns really nicely with our mission to advance the health of our community. And knowing that we're taking a more holistic approach to healthcare, really looking at the person, not only the chronic condition that they might have or medically speaking, but also looking at their mental health, social well-being, starting to pay attention to the social determinants of health. It's really critical that we have a good understanding of how health equity plays into diversity inclusion programming.
So as you talk about diversity and equity and inclusion, it being a healthcare provider, that's not just for the organization and its workforce, understand the importance of that with the patients. This is also employee to employee, physician to employee, employee to patient. There's when you say holistic, there's a lot more that goes into it than just quote training for the workforce in dealing with patients. Correct?
Correct. We like to focus on, again, looking at our mission to advance the health of the community from that holistic lens. I would say that these are not always the newest of initiatives. Really, it's about looking more fully and more deeply at the work that we've always done in providing high value quality care. So we're really looking at it more so from a development perspective, being more strategic about how we integrate diversity, equity, and inclusion into the work that we've always done.
So you mentioned, the strategic side of that, and making sure that's integrated in what we do every day. Can you talk to us a little bit about what are some of your strategic goals and plans for 2021 and beyond?
So for 2021, really starting to educate people about when we say diversity, equity, and inclusion. I don't know that it's always understood. So that's been a big part of our initiatives, is raising the level of awareness around what that actually means. And then, of course, providing education as it relates to those topics from a medical perspective and why it's important to healthcare. Also looking at traditional things like bias, microaggressions, how those play out in our interpersonal relationships. As you know, in healthcare, it's a very much interrelated kind of profession where you really do have to rely on your team members. So a lot of the work is starting internally, and then we're looking at focusing more on the patient side of how we start to impact some of those social determinants of health.
So maybe for our viewers who may be employees, they may be physicians, they may be patients, or even family members of patients, if you can break down those three words. What is the diversity piece? What does equity mean? What's inclusion mean as we see it as Kaleida Health?
So for our system, we're focused on diversity being really any characteristic trait of human, but we're looking at the ones that have historically and traditionally been marginalized or minoritized, depending on the area. For us, that's been important not only from a race, ethnicity, socioeconomic perspective, but also looking at sexual orientation, looking at veteran status, as we know that veterans sometimes don't have great health outcomes. We're also looking at working parents and caregivers caregivers in this unique COVID situation that we found ourselves in here, and really trying to pay attention to those unique identifiers throughout the system. LGBTQ and gender identity status, of course, is a part of that also. As it relates to inclusion, so that's not only that people feel good that they belong here, but really that what they say brings value to all of our decision-making processes, our policies. So looking at inclusion from the lens of valued as well as shared voice and belonging. And from an equity standpoint, we're really looking at the root cause of why we would see discrepancies as it relates to healthcare. So that's again circling back to those social determinants of health, which can sometimes be a bigger cost to someone's health outcome instead of just the traditional non-compliance.
So Kaleida Health is a very diverse organization, 13,000 employees. We stretch from the city of Buffalo up to Niagara County, all the way down the southern tier into Pennsylvania. We're a diverse workforce. We serve a diverse population. We're in diverse communities. Why is it so important?
Right. It's important because we want to start to really leverage all of that diversity and do so, again, in that strategic manner. I think these things have always occurred unofficially, but the more that our communities grow, the more that our reach grows, it's important that we can actually hear from each of those different sectors and bring it into our business. So it's about leveraging all of the diversity that we have and using that to really be a leader in the field, not only in healthcare, but of course in Western New York.
So you've had your hands full in the short time you've been with the organization. Can you give us some examples of some of the work that you're currently involved with or that we're working to get across the system?
So in addition to our patient making sure that our leadership has the support that they need to really start to think about how diversity, equity, and inclusion shows up in their day-to-day function and work. So they will have their own separate education series that is a little bit more than what we're able to offer for the rest of the workforce. So they will be given additional support and guidance as they're leading the organization. In addition to that, we do have a few key initiatives happening around sexual orientation and gender identity data and how that's captured throughout our health system. We're also paying attention to our language access services and really making sure that people understand how to utilize that when serving patients throughout the system. And finally, for our working parents and caregivers, we've really started to look at just that they understand how to utilize all of the benefits that are within the organization already. We have such a large workforce, so sometimes trying to simplify that for people can be really a benefit to them to know how to utilize what we have available.
And from an impact standpoint, whether it's workforce, patients, community, that makes us a better employer, a better provider of healthcare services, a better community provider. Is that the goal of all this?
Absolutely. The goal is to make sure that everyone who works here feels supported, really that their career is enhanced by being a part of this organization, which we have so many people of different backgrounds and different career paths. And there's really a lot of opportunity that we want to offer to Western New York in general.
So you mentioned social determinants of health, and we'll wrap up with this. That's a relatively new term, maybe in the mainstream media or for the public to know, but it's something in healthcare we've talked about for the past few years. Talk to us about the importance of that, how it's defined, and then why an organization like Kaleida Health would be interested or focused on something like social determinants of health.
We like to think about the social determinants of health are all of those other things that really impact someone's well-being. So we're looking at social factors in someone's environment, whether it be transportation or built neighborhood or walkability, pollution, paying attention to school system, economic development. So really starting to say if someone's going to follow their prescribed treatment plan, how do all of those things actually sometimes impact their ability to do that? Health literacy, understanding how to read, all of those things really really start to play a key role in someone being able to actually carry out their treatment plan. So for us, we're very hopeful, and we know that that's going to be important to someone's ability to be able to stay well. So it's not just about triaging folks and making sure they're well in the moment, but really have the longevity to impact communities throughout the Western New York community.
Well, Shannon, thank you so much today for joining us. Obviously, be able to talk about the benefits of bringing DEI to the workforce as well as to the workplace. We hope that, as you move forward and you make progress, you'll come back and join us again on Medically Speaking.
Thank you. Thank you for having me.